Kyle Blecha joining us here now, again, in place of Dr. Richard Ma. But we're going to keep the subject the same, and that is they would call them musculoskeletal injuries, but muscle injuries, pulls, strains, tears. When you see that, I mean, how quickly or how easily can you kind of diagnose either the degree, the severity, or the recovery time when the athlete presents?
It's not always easy. You got to factor in each one a little bit separately. Something that knowing is anything they've had pre-existing or prior, whether it's in the groin, it's a hamstring, quad, and then looking at what their level of strength is, or any swelling, as well as have they lost any range of motion. And from there, you kind of get an idea of, if this is going to be a short-term recovery or it may take some time. And then bringing in, your physician in to help, further assess, maybe get some diagnostics with X-ray, MRI, or CT, whatever, their preference is.
Mm-hmm. Okay, we use sprain, strain, tear. What is the more accurate descriptor for muscle injuries?
Muscle strain.
Okay.
So is it a strain or a tear? It's so easy in the layman to say it's a tear. But a strain is the term you want to use. You grade it mild, moderate, or severe.
Okay, and where we also see it, especially we see it on injury reports, grade 1, grade 2, grade 3. So if what is the kind of the quick definition of each one?
A grade 1 is, it's going to be mild, where there's, limited strength loss, there's limited range of motion. Grade 2 is going to be your moderate, where there's a little more strength loss, may have some changes in the muscle tone. And then a severe grade 3 is where there's, a separation of the muscle fibers, whether it's at the muscle tendon area or in the belly of the muscle, where you have quite a bit of swelling and there's significant loss of range of motion, strength, and may not be able to bear weight, particularly if it's a lower extremity.
As you look at grades 1, 2, and 3, where they occur on the body, obviously past history of certain athletes. Are there times when a guy with maybe a grade 1, in an area that might not hamper their range of motion or something, where you could say, okay, listen, you're gonna have to take care of this, but tonight you're okay. You can get back in there. You can do some things. Is that still a possibility, or once you're getting into 1, 2s, and 3s, it's pretty much time to shut them down?
If you have something that's mild, you're going to want to, modify their activity, back them off. And the other things, you have to consider, is what their position is. If you look at sports, where are they at in the field? Are they, look at football, are they interior linemen? Are they running back, a skill position? And all those can factor into what that time frame looks like. Somebody that skill position that needs that burst and has that needs that cutting ability, you're probably going to shut down sooner than later, just so that you don't make it worse, and because that can help, because that can hinder what their availability is later in the week, for the upcoming game, or what the schedule looks down the road.
Kyle Blecha with us, Missouri Orthopedic Institute, and again, a reminder, they've got the free walk-in clinic on Saturday mornings from 9 to 10 a.m. over at Missouri Orthopedic Institute. It's fully staffed. They can provide referrals. They have X-ray machinery there as well, but that's a great place for you to start on Saturday morning. If your young athlete, after a Friday night of football, isn't quite up to snuff, you want to get that checked out. We've seen a lot. I mean, I looked at the Chiefs injury report, and I see hamstrings, I see groins. There was a groin and a hand, which is an awkward combination. But you get those lists. Mm-hmm. When you've got a high-level athlete, hamstring or groin, which is the one that you are most concerned about as far as recovery time for that athlete?
It's hard to separate. I think they're both significant injuries. A lot of times when you look at the injury report, there's a lot of things that goes into it. It could be just a piece of information. Hey, you just want to make somebody aware of it. Mm-hmm. To there is going to be a limitation in practice, and that limitation will be set by the medical staff with the coaching staff as far as what they can and can't do during practice. But either a groin, hamstring, those are can be hampering injuries down the road, particularly if you don't take care of them and address them, appropriately. Mm-hmm.
Obviously, high school coaches, especially, that's who we're kind of dealing with here in these discussions. High school coaches aren't EMTs. They're not doctors. They're not first responders. They don't have human anatomy probably in their background. Do you find, though, that when a coach takes an interest, maybe even more than a passing interest in this kind of stuff, that it helps the team in the way that he knows how to handle injuries and communicate with health professionals?
Yeah, I mean, it's helpful because that's going to be that link between you and the athlete or the parent. There's going to be that ongoing communication, and as well as they know what where that player is going to be needed when it goes into that upcoming game, or what they need to be doing in practice, or things in which they need to be probably held out of this, so that you don't further injure this. The strain.
We talked with a lot of coaches over the time here, and one of the more unique aspects, and you have found it living here for a little while. Missouri, 1 week on a football Friday night, it's 80 degrees. The following football Friday night, it's rainy and 30. How do you recommend the athlete prepare for that game to get loose? I mean, to make sure that we're trying to prevent these injuries, as opposed to what we just went through is how to treat them.
Well, I think it's that preparation going into that stretching or dynamic warm up is crucial for practice for a game as they're getting ready to break off into their groups, and giving that time for that warm up, get the heart rate up, get the muscles blood flowing in the muscles, and then addressing appropriately, make sure they got there's layered up for that cold weather. And have hydrated and done the necessary things nutritionally to prepare for the colder weather, because it is a little bit of a different beast when it comes to colder weather.
We look at it and we assume that the injury rate would be higher in the colder weather as opposed to the warmer weather. Is that assumption based on fact, or is that something that is just kind of a wild hair guess?
I think it's injuries come and go. There's peak. You have years where they're extremely high and some low. So it's really, I don't think there's much science to it as far as the rates, other than but there are trends when it comes to the length of a practice. Where injuries may occur, whether it's beginning, middle, or late in a practice. If it's and that's why you've seen some of the research come in about the amount of time somebody's practicing. Mizzou Athletics has some unique systems in which they can track somebody's practice time, the number of reps to the number of time they're practicing, to differentiate whether it's the cutting more on the left or the right. So
the biometric units. We saw a couple of the ladies last year for women's basketball. Harnessing up with the biometric feedback. Duke uses that as well. Kyle Blecha, athletic trainer with the University of Missouri, with us here. The MOI clinic, again, is from at 9 to 10 a.m. in the morning on Saturdays. Over at MOI, it's free walk-in clinic, referral available, x-rays, assessments are all available on that as well. With muscle injuries and all that, especially as we're getting later in the season, you mentioned the fatigue aspect and measuring out how long practices and all the rest of that. How much do you have to work with coaching staffs to make sure that the practice times and the fatigue levels are still kept within range? Because as you're later in the season, the fatigue seems to creep up a little bit quicker just because of how deep in the season you are.
Yeah, you look at a college football season. It's 13 weeks long with a bye week, and there's things you're not installing are implementing that where it lengthens a practice because the fitness level is there. They have they're still going through the weight and strength and conditioning with the coaches, and it's mapping out to what are necessary reps for some of your starters or having trying to scale things back so that you can get them into that late November, December type matchups.
Kyle Blecha with us here. We'll go circle back here to the high school level because you've got a lot of parental involvement on this. You've got coaching involvement. You've got the trainers with each one of these schools that are involved in this and as well. As an athlete, what can they do? Just initiative or, what can they do to make sure that they're healthy enough and that they can avoid these strains and sprains?
It's important to continue with strength and conditioning, stretching, taking care of their bodies, getting appropriate rest, as well as making sure that their body's fueled as they get through the year, and essentially just taking care of themselves. And being aware of, there's a lot of studies, a lot of research going into just sleep, appropriate sleep, and getting people off their feet, and maybe doing some mental type preparation, mental reps.
How hard do you have to work with the parents?
Parents are really good. They listen.
All right. Well, we'll just kind of leave that right there. Again, parents, this one is for you. 9 to 10 a.m. Saturday morning, Missouri Orthopedic Clinic. It is free. Referrals, x-rays are available, especially after a busy Friday night, and it's going to be a wet, chilly one this coming Friday night. So you want to keep an eye on your athlete, especially when they got out of bed on Saturday morning, and get on over there. Again, it's a free clinic, Missouri Orthopedic Institute, 9 to 10 a.m. Kyle Blecha, thank you, man. I appreciate it.
You're welcome.
All right, you're
here.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.